so I'm gonna knock knock. I'm
Hi.
gonna come in. Hello. Hi, my name's Abby. I'm gonna be your nurse today. Can I have your name and your date of birth?
Lisa M. 3519XTX.
Perfect. Perfect. So I would double check that on her wristband. She is who she says she is. So, do you have any pain today?
I don't.
Great. Well, I'm here to do a head to toe assessment. It'll take about 10 minutes.
Okay.
Is that okay?
Yeah.
Okay, awesome. So, no pain. As she's answering my questions, I'm looking to make sure that she's making eye contact, she's alert, she's answering appropriately. So, do you know where you are?
I do. I'm in Hampton, Maine.
Awesome. And do you know what day of the week it is?
Sunday.
Great. So she is alert and oriented to ×3, person, place, and time. So I'm going to start the exam by looking at her head. So I'm looking, it looks symmetrical, her hair looks good, it looks lustrous, it looks healthy, she doesn't have any balding or any hair loss or anything like that, no critters in the hair. So I'm going to go ahead and just palpate. So I'm palpating her head, just feeling for any lumps or bumps. Do you have any pain?
I don't.
Nothing like that? Okay, great. So I'm going to look, and I'll just make a note, as I'm doing her whole exam, I'll be looking at her skin. I'm looking at its color, if she's jaundiced, cyanotic, if she has any pallor, anything like that. But right now her skin looks good. She has good color, and yeah, so I'll just be making comments like that throughout the video. So as I continue, I'm going to be looking at your eyes, and I'm looking, and there's no drainage, no deformities, anything like that. Her eyebrows are even, and she has full hair on her eyebrows and whatnot, so no hair loss. So pretending this is my pen light, my other pen light is kind of too bright. So I would ask her to look at my nose, and I'd sweep in from the side with my light, and I'm looking for equal accommodation in the other eye, equal reactivity. And then I would have her keep looking, and I'd have my pen light on and go into that eye, looking for equal reaction in the other. And then to finish up the Perla exam, I'm going to have her follow my finger. Perfect. So that was the accommodation portion of the Perla exam. So next, just continuing with the eye assessment, I'm going to have her do the 6 cardinal views, basically. So I'm going to have you follow my finger nice and slow, just to not make you dizzy. Nice job. So her eyes are moving equally. She doesn't have any wiggling or anything like that in her eyes. Perfect. Awesome. Great. And I'll do the peripheral vision test next. So I'm going to have you cover one of your eyes. And whenever you see my fingers, just say so, okay?
No.
Awesome.
No. No.
Perfect. And I'm going to have you cover the other eye.
Mm-hmm.
And same thing, just tell me when you see them.
No. No. No.
Okay, perfect. Great. So I'm next going to have you extend your neck up and then flex it down.
Okay.
Perfect. And then turn it side to side, just looking for range of motion in the neck. Awesome. So it looks good. Any pain?
No.
Anything like that? Okay, great. So now I'm looking at her nose. I'd have my pen light. I'll use the flashlight this time. But I'm just looking. It looks equal on the outside. I'm going to look inside. It looks, she doesn't have any lesions, no bleeding, no deviation. I'm going to palpate her sinuses. Do you have any seasonal allergies, anything like that?
I don't.
Okay, great. So this is the frontal sinus, and this is the maxillary sinus. Great, so next I'm going to look in her mouth, and as I'm looking at her mouth, I'm also looking at her lips. Her lips look moisturized. She doesn't have any lesions or any dryness or anything on her mouth. So I'm going to have her open her mouth and say, ah. Perfect. And I looked, as she said, ah, and her uvula rose up, but it did so equally. And I'm also just looking at her mouth real quick. I'm looking for any sores, any lesions, anything like that, any red spots, but it all looks really good. No erythema. Great. Do you see a dentist regularly?
I do.
Okay, awesome. Great. So I'm going to move on to her ears. So I'm just going to look in her ears. They look good, no drainage, no piercings, anything like that. Looking behind her ears, it's pretty common for people to not put sunscreen on, so it's a common area for lesions, and I'll do the other side. So looking, looks good. Look behind the ear. Awesome. No lesions, any sores. Now let's push in the tragus. Any pain?
No.
Great. Do the whisper test. So I'm just going to whisper a simple 2-syllable word, and I'll just have you repeat it back to me, okay?
Okay.
Baseball.
Baseball.
Mm-hmm.
Apple.
Great. Perfect. So she passed that. And I'm going to have you remember 3 words. I'm going to have you repeat them back to me at the end of the test, okay? So the 3 words are yellow, sailboat, spring.
Okay.
Okay, so yellow, sailboat, spring. I'll ask you at the end.
Okay.
Part of the neurological exam. So now I'm going to feel her carotid pulse right there. I'm not going to feel them both at the same time as to not cut off circulation to her brain, but it feels good. It's strong, +2, no irregularities. I'm also going to take this time just to feel the rest of her pulses, so I'll feel the radial pulses, and they feel equal, +2 strength. Next, I'll feel her dorsalis pedis pulses, right about here. And again, I'm looking at her feet, and her feet look good. She has no sores, no pallor in the feet or anything like that. So that felt good. Those were equal, +2 on both sides. Next, I'm just going to have you separate your feet just a little, and I'll feel for the posterior tibialis pulse, which is right behind the ankle. There we go. Great, and they feel equal, +2. Perfect. Great, and I'll take this moment to just to look at her capillary refill in her feet. So I would do it on her nails, but I'll just do it right here on her skin. It should be under 3 seconds. That was just about there. And I'll do it on her fingers. Just about 3 seconds, so that's perfect. Okay, great. I'm gonna continue with the neck assessment. So I'm gonna feel for her lymph nodes next. So I'm just gonna feel the supraclavicular. I'm feeling the lymph nodes for any bumps, lumps, tenderness, see if she has any pain or swelling. Just let me know if you have any pain, okay?
Okay.
So that's the supraclavicular. I have the anterior cervical, the posterior cervical. I have the occipital. I have the preauricular, postauricular. I have the submental and the submandibular. Next, I'm going to be looking at her neck, and I'll have you just lay back for me.
Okay.
And at a 30 to 45 degree angle, I'm just looking for any distension and neck vein distension. So there is none, so that's perfect. I'll look at the other side, but yeah, okay, great. So I'm gonna now feel her trachea and her thyroid gland. So I'm just gonna feel her trachea. I'm just looking. It looks even. I'm looking for symmetry. I don't feel any lumps or bumps. Can you swallow for me? Perfect. That allowed me to feel the thyroid gland more easily. And I don't feel any lumps or bumps or nodules. It doesn't appear swollen or feel swollen. So perfect. Okay, great. So you can see actually, I'll have you sit up. Sorry. Thank you so much. So next I'm going to listen to her lungs and heart sounds. So first, her lungs, I'm listening in 4 spaces, anteriorly and posterior. So first we'll listen above the clavicle. Let's have you breathe in through your mouth for me, okay? Awesome. And again. And 3 spots, like I said. Perfect. Now just listen kind of in the axillary region, and that one right there. Perfect. Okay, great. And I should be comparing side to side, so I would go in the ladder motion. That way you can make sure the sounds are equal bilaterally, but her sounds are clear and soft. I don't hear any adventitious sounds. Okay, nice through the mouth. Thank you so much. And so I would go like that and down and across. But so that's the second spot. Perfect. And then I'll just listen right up here. Perfect. So those sounded clear and equal bilaterally. It sounded soft, no rails, wheezes, anything like that. So next I'm going to listen to her heart in the 5 spots, ape to man. So first I'll listen to the aortic. You can just relax for this. Yeah, just listening to your heart. Thank you so much. So aortic, pulmonic, S1 and S2 are noted. I could also be listening for S3 and S4. And she did let me know that she has a murmur, benign murmur, and S3 murmur. Perfect. And the next spot would be Erb's point. Perfect. And then the last spot would be mitral. Just gonna put right there. Perfect. So again, S1 and S2 are noted. So that's great. And then I'll move on to respiratory sounds in the back, posteriorly. Perfect. Alrighty. So we'll start up here, and we just have to make sure we avoid the scapula in the back. So let's have you breathe in through your and out through your mouth for me. Thank you. And we'll compare side to side this time to do it right. And we'll do 4 sounds. 4 spots, I mean. And the sounds are soft. I don't hear any rails, wheezing, anything like that. Yeah. Okay, perfect. Thank you so much.
Welcome.
Great. I'm going to listen to her carotid sounds next. I'm going to use the bell of my stethoscope. And what I'm going to have you do is just breathe in and then breathe out. And I'm going to listen to that carotid artery. I'm listening for any bruits, which would be kind of turbulent sounds. Nice. Nice job. Thank you. Perfect. So it all sounded normal. No turbulent sounds, no whooshing or anything like that. So it sounded good. Next, I'm going to do the abdominal exam. So I'll just have you lay back. And I'll just start with kind of a few questions. You're not having any pain in your belly today?
I'm not.
Awesome. And how do you feel about your diet?
I think I have a good diet. Once in a while, probably a couple times a week, I like to eat something very sweet.
Okay.
So good diet, but then I indulge.
I think indulging once in a while is okay.
Okay.
So, have you been having normal bowel movements?
Yes, no problems.
Okay, awesome. And normal urination?
Yes.
No
yeah.
pain or anything when you use the bathroom?
No.
Awesome.
Thank you.
Okay, great. So I'm going to have her lift her shirt, and I'm just going to be looking at her abdomen first. I'm looking for any palpations in the aortic region. I'm also just looking at the skin color. Again, we're looking at skin as we go through. Looking for scars, bloating, asymmetric, but everything looks good. She doesn't have any asymmetric, no scars, no bloating. So I'm going to go ahead and auscultate. And I'll start in the right lower quadrant. And I'll listen to the diaphragm. So I'm just going to listen until I hear a sound, and then I'll move on to the next quadrant. Awesome. And if I wasn't hearing anything, I would listen for 5 minutes. But So far, normal, active. Sounds good. Awesome. And last one. Perfect. Okay, great. So next I'm going to warm my hands. I'm going to palpate. So I'm just going to start in the right lower quadrant, and I'm just going to kind of get her used to my touch and just make sure there's no pain. And she might be a little ticklish, so I can use her own hand. So we're just going to palpate right here. Awesome. Awesome. And then I'll do the same thing right here. Kind of just feeling, I can feel the, awesome. Perfect. Almost done. And this is a deeper palpation. So we start with light, then we go to deeper. Perfect. So no pain, no tenderness, anything like that. So that was all normal and good. So I'll have you put your shirt back down. Perfect. And next I'll have you sit up.
Okay.
And we're going to do some strength tests. So I'm going to have you lift up against my hands. And then I'm going to have you put your arms out straight and push up and push down. So strength is equal. And it's a 5 out of 5. And then at the wrist, I'm going to have you push up. Nice. Perfect. Good wrist strength, equal. Push down. Lovely. Next, I'm just going to have you extend your foot out straight and back. Perfect. And then straight and back. And then I'm going to have you kind of run up like that. And she's following directions well. She has equal strength on both sides. So that's kind of what I'm looking for. Great. Next, I'm going to do her feet. So I'm going to have you push down. Perfect. And push up. Awesome. And then I'm going to have you do plantar flexion and dorsiflexion. We kind of just did it, but we'll do it again for good measure. So we'll do plantar flexion down, dorsiflexion up, and the other side. Plantar flexion down, dorsiflexion up. Perfect. Looks good. She's able to follow directions. She has equal movement in both limbs. So next, could you mind telling me those 3 words that we said earlier?
Yellow sailboat spring.
Perfect. So she passed. Awesome. So next we'll move on. If you can stand up, we'll do kind of musculoskeletal, that kind of assessments. I'm just going to have you walk right here. And I'm looking at her gait and her posture. It looks even. You can turn around and walk back. Lovely. And she doesn't use any assistive devices or anything like that. So I'm going to have you stand right here and just close your eyes, making sure your feet are close together. This is the Romberg test. It's just testing for balance. Musculoskeletal, kind of neuro. You can close your eyes for me. At about 30 seconds, we're just seeing if she has any movement. And if she would, that would be a positive test. That would require further evaluation. Great. Perfect. Awesome. Great. So we'll say that's about 30 seconds. Negative test. She was had good balance. So I'm going to have you bend over at the waist. And this gives me a chance just to look at her spine. I'm looking for scoliosis. That would be if one of the scapula was higher than the other, a lateral curvature of the spine, but she doesn't have that. So I'm looking at her skin. Her spine looks straight. Skin looks good. So I am going to just palpate the spine. Any pain or tenderness?
No.
No. So I'm kind of just feeling for any lumps or bumps. It feels good. Again, her spine is straight. Perfect. No pain. Awesome. Great. So I'll have you sit back down.
Okay.
Awesome. Great. Next I'm going to do a sensory kind of test. So I'm just going to have you close your eyes and tell me when you feel something, okay?
I do.
Okay.
No.
Alrighty.
No. No. No.
Perfect. I'll do on her arms. And as I'm looking at her arms too, I'm also looking
No.
for any IVs,
No.
which would require further
Mhm.
assessment.
Mhm. Mhm. Mhm.
And I can also do her legs. Perfect. This gives me a chance too to look at her legs. And I already felt the pulses down here.
Now. Yep.
Perfect. And I'm gonna just feel for any calf tenderness. Any calf tenderness or pain. Okay. Awesome. Great. Perfect.
Thank you.
Yeah, no problem. So as we're wrapping up the test, and I'll say this, as I'm looking at her legs, I'm looking for any swelling, any edema, which she doesn't have. Her feet look good, so on both sides, no edema. We can kind of do the test, but she has no pitting, anything like that. So that all looks good, and we did capillary refill, but we'll make sure we do that again. So basically make sure it's less than 3 seconds on both the feet. Perfect. Well, that pretty much wraps up the exam, but before I go, I'm going to make sure that she's safe. So I'm going to make sure that her bed rails are up, she has her call-out within reach. Ask her if she needs anything.
I don't.
Okay, great. So then I would basically document the test or the assessment. That would be over. It would be complete. So anyway, thank you very much.
Thank
That's
you.
the end of this assessment.